Everyone, welcome. I'm Caitlin Dutton, the Director of Family Engagement at Barnard. We're so excited to welcome you to campus in just a few short weeks. And it's great to have you here today for the first of our information sessions for incoming students and their families. So we're going to start today with our Student Health and Wellbeing webinar. I'm excited to have a great slate of panelists here with you. During these conversations, we'll share what to expect as students navigate the transition to Barnard and embark on their first semester, as well as how families can best support their students throughout this time. We aim to answer your questions and to help you feel more prepared and knowledgeable before stepping foot on campus. Health and wellness, of course, are fundamental to student success, both inside and outside of the classroom. Today, our campus partners will discuss Barnard's holistic approach to health and well-being and the many resources and services available to students across the many dimensions of wellness. Throughout the presentation, please use the Q&A function to submit your questions, and be sure to save time to answer them at the end. Without further ado, I will pass it to our first speaker, Betty Boyle-Duke, Associate Director of Nursing at Primary Care Health Service.
Hi, good evening. Thank you so much, and welcome to Barnard to all our new families. So yes, I am the Associate Director of Nursing. I'm also a nurse practitioner at the Primary Care Health Services. We call it PCHS because it's a mouthful, but it's basically the Student Health Center on campus. So just to begin, just wanted to share our mission at PCHS. So it's really to provide excellent clinical health care to our students at Barnard of all genders and identities. And we do so in a sensitive, non-judgmental, and responsive manner. We wish to promote the health of body, mind, and spirit within the student community. And I say student community because our health center only services our students. Some colleges and universities, their student health center also provides services to staff and faculty, but our student health center is only for the student community. And so we also wish to educate our students to become knowledgeable and effective users of healthcare, because for many of our students, this is the first time that they will be navigating healthcare on their own and becoming consumers of healthcare. And so we are there with them along the way. Our services are available to all students, regardless of insurance status, and I will speak a little bit more on that. The other thing I wanted to bring up is that we are accredited by HHC, and that stands for Accreditation Association of Ambulatory Healthcare. And we're very proud of the fact that we go through a process so that we keep our accreditation in terms of providing top clinical care for our students. We also have here for you our website. The slide deck will be shared, so you will have access to it, but we just thought it was important to share this because a lot of the information I'm going to go over can be found on our website. So just to discuss a little bit about the specifics. Our phone number, which you will also gain access to as well, but we have it here, is 212-854-2091. We do ask students to give us a call for appointments. We don't typically take in walk-ins just so that we can ensure that whatever the student needs, the correct type of appointment is made. We're also working on self-scheduling. Hopefully that will be in place this fall through our portal. But we do ask students to call ahead just in terms of the type of appointment they need or whatever services they need that we can accommodate for that. We're located in the lower level of Brooks Hall. All of our offices and our clinical space is in the lower level of Brooks Hall. So for students, when they come into Brooks Hall, they would swipe in if they're not residing in that dorm per se, come in and they would take the elevator down to the basement and follow the arrows to PCHS. We're open from Monday through Friday, 9 a.m. to 5 p.m. And I'm sure you're wondering, what do I do if I get sick at 6 p.m.? We do have after hours. It's called Access Nurse. You would call the same telephone number, which is why we have it there for you. If it's during clinical hours, you would just press 1 to speak to our scheduling desk. If it's after hours, it will give you prompts to reach our after hours nurse access line for medical advice. This is a third-party entity, so they're not Barnard staff. So for questions like would my insurance cover something, or, what time will the nurse practitioner be in? It's not Barnard staff, so they wouldn't be able to answer general questions like that. But if you do need medical advice or clinical care after hours, that would be the telephone number, which is our number, and you would just hit the prompt to be connected directly to Access Nurse. In addition, although they are not Barnard staff, we do have our own staff, such as myself and the other providers. We have 2 pediatricians and 2 other nurse practitioners, in addition to myself, who are on call, so that in the event that you do reach the after hours line, if you need to connect with one of the on-call provider, that will happen as well, just so you know. Went the wrong way. Okay. So what are the services we provide at PCHS? So we are there for students when they're not feeling well. We call these urgent care or sick visits. So I have a sore throat. I think I'm coming down with the flu. We coin them as urgent care or sick visits. And usually, by and large, students can get in fairly quickly to be seen when they're not feeling well, usually same day. And we also have physical exams. Most students come in, you're just starting college, you just had a physical with your pediatrician, your primary care provider, you just received some vaccines, but sometimes students come in, they want routine physical exams or checkups, which is fine. A lot of students are also engaging in study abroad, or they want to volunteer at a local hospital or a lab based on their extracurriculars. There may be a form that needs to be completed for that. And by and large, those forms need a physical exam to be completed by a nurse practitioner or physician. And we certainly can do that at PCHS as well. We also offer STI screenings of all types right on campus. It's confidential, and we have gynecological related visits as well. So students have irregular periods or any concerns around the gynecological system, we can manage that as well. We also provide contraceptives, initiation and management. Some students may already be on contraceptives. We can certainly help with the continuation of those services. Or if they're interested in discussing starting contraceptive, we could do that as well. And we'll maintain it as well. And this includes long-acting reversible contraceptives, such as IUDs and Nexplanon, which we do on site as well. The other thing that students will come to us for are referrals to specialists. So students who have are at the student health, we call it ASH, so the school-related insurance, when they have a need to see an outside specialist, they would come to us, and we would provide them with a referral, whether it's dermatology, cardiology, they have allergies, whatever the specialist is. They would come to us, we would set up an appointment to discuss, what's the best person to see them for that, and provide them with a referral. Students who may have Blue Cross Blue Shield or straight Aetna or United Healthcare, they've waived the student insurance, and they're remaining on their parent or guardian's insurance. We can still provide them with information on where they could go for a referral. It's not mandatory. It may depend on the outside provider they're being seen. It's important for those students to perhaps check with their insurance carrier or the person they're being referred to ensure that they take their insurance. By and large, most of the major commercial insurances, the providers that we work with take Blue Cross Blue Shield, Aetna, United Healthcare, Medicaid. Sometimes some students may have something called TRICARE if their family's military related. Some of those may are a little bit tricky, but we do work with students in finding area providers that accept that insurance. And then in terms of other services we provide, we certainly also have trans and gender diverse care. One of our pediatricians specializes in this. And so we're able to offer hormone treatment, physical exams, counseling around binding or chest therapy, referrals for any primary care services that are needed around trans and gender diverse care. And we also provide, lastly on this slide, immunizations. We do a lot of immunizations right on site, and we have supplies. And for students who are going to study abroad, we also have visits with our nurse who will have travel visits, and we'll work with students and walk them through what immunizations they may need to travel abroad as well, if that comes up. The other, this QR code is for our contact information. I'd stated before that we would share the slide deck, but we also wanted to just include our contact information with this QR code. If you want to use your camera to scan it, it will actually create a contact for our information for the PCHS directly into your phone. The other thing that I just wanted to mention when I was talking about the services, the other service that we have when for students, just to make note of, is that we do have a vending machine. And the vending machine obviously is available to students 24 hours a day. There are over-the-counter medications that maybe they call the after hours line, and they were given advice to take, you know, Tylenol for pain or some, you know, Sudafed or something like that. They can purchase that at a nominal cost at the vending machine at any time. There are some free items in the vending machine, such as condoms and sanitary products as well, but I did want to just let students know about that as well. And lastly, for insurance, the other thing that sometimes comes up in terms of insurance is around dental care, and I just wanted to mention that. That is not a service that we provide at PCHS, but we do link students to dental services. If they have the student insurance, ASH, the Aetna Student Health, and they're under 19, it is available for them to get cleanings and x-rays and preventative care that as long as they're under 19. Once they're over 19, there's really not any dental coverage, but we're able to link them to area dentists in the area for dental needs that they may have. They may use their private dental insurance if they have it, or we're able to provide linkages to some of the area dentists, such as Columbia School of Dentistry or NYU School of Dentistry, where they have sliding scales, and a lot of students have found that very helpful. So I just want to make mention of that as well in terms of services. Not something we directly have, but it is something that comes up for students. I think this is my last slide, and hopefully everyone got an opportunity to scan the barcode. So I am going to, I think it's Dr. Shaw who will be speaking. Thank you.
I think I need permission to start my video, but I'm asking if I can have permission to start video. Hi, so I'm Dr. Shaw. I'm one of the leaders at the Furman Counseling Center. I'm one of 2 psychiatrists there, and I'm also a Barnard alum from the class of 2004. So it's wonderful to see everyone on today. The Furman Counseling Center is a center that promotes social and emotional development for all of our incoming students to really facilitate the richest college experience that they could have. We do this through a range of mental health services, which I'll highlight on my next slide. And part of our mission is really supporting the college's broader commitment to diversity, awareness, raising awareness of systems of oppression and unequal access to resources, and working to promote social justice in our work. So we provide a number of mental health care services. They are all free. We do not need to use a student's insurance. We offer free and confidential mental health care. And we offer several different types. So we have short-term therapy. We really work on a short-term model, but those would be individual therapy appointments. And we offer medication management. That also is short-term. So we have 2 psychiatrists, myself included, and a number of clinicians that provide psychotherapy, including licensed clinical social workers and psychologists. We offer both in-person appointments as well as telehealth appointments. And we also run a number of groups. So group therapy, support groups, as well as other outreach throughout campus. We help students find referrals in New York City and beyond, mostly because we are a short-term model and we try to get students linked to other longer-term providers that take your insurance. We are available after hours for support for emergencies, and you can call the same number as our regular line. after hours. And our website is listed here as well. So some of the common themes that we see among our students, especially our first years, is really just transitioning to Barnard and transitioning to college life. So any of the stress can go along with the transition, moving on to college, moving away from home, moving to New York City, being separated from their prior group of friends, navigating some new academic stressors. Those are things we see a lot. Sometimes there's acculturation or homesickness. Other things we work on with students is really relationships, whether those are friendships, romantic relationships, family relationships, social anxiety, loneliness, isolation. And we really try to help with coping strategies and gaining new skills to manage in this new environment. Common core theme is really identity development, since all of our incoming students and even college students are really at such a formative stage in their own development. And we manage a number of mental health diagnoses and challenges among our students. So a number of our students will have diagnoses of depressive disorders, anxiety, trauma, and eating concerns. And for some of those, we partner with others. For eating concerns in particular, we often partner with PCHS as well. So I wanted to mention how students access our services. Like PCHS, we are located in the quad. We are on the ground level of Hewitt. And so it's the same building where a lot of our first years actually dorm. And so to make a routine appointment, students can call the office, they can email us, and we usually schedule a brief appointment and then a longer intake with the most appropriate clinician. For urgent appointments, we do offer urgent walk-ins and same-day appointments, Monday to Friday, and select days we do have some late hours. And then we always have an after-hours emergency line. So this is for any sort of mental health crises. That line is available every day after hours on weekends. We do have a service that manages the initial call, and then they relay concerns to our on-call clinician. So Furman always has a licensed mental health provider who is on call for our students. We rotate every week. So there's always a backup Furman staff person actually on call for any after hours mental health emergencies. Some of these are coming from our students directly, but we do get calls from other campus partners as well. And lastly, I wanted to just highlight two additional considerations in wrapping up. So for students with a history of mental health challenges that might impact school enrollment, families can consider tuition insurance. And so if there is a medical or psychiatric consideration that might require a leave for treatment, that's one thing families may consider. And for students that are referred to Furman, we provide care in a short-term model. And so we often will refer our patients then to outside mental health providers. And so we do recommend the Aetna student health insurance because we just have much more contacts in New York that will accept it. There's a lot of limitations in what insurance is accepted by providers in New York City. There's a number that might not take insurance or might take very select insurances. And so it is worthwhile to look into the Barnard School's insurance option for some of our students that have state-specific insurance, and we have students from really almost every state and other countries. Sometimes it's very, very, very difficult to find anyone in New York State that might take a particular insurance, especially if it's state-specific for another state. So that's something to consider before coming to Barnard. And again, this is our Instagram and our website for more information. So thank you. And with that, I'll pass it on to Kiswana, who's one of my colleagues at the Furman Counseling Center.
Thank you, Dr. Shaw. Like Dr. Shaw said, my name is Kiswana Alexander. I'm a licensed clinical social worker and a psychotherapist at Furman Counseling Center. I also am the alcohol and drug specialist, and I oversee all of the programming through the LeFrak Foundation Alcohol and Substance Awareness Program, ASAP, where our goal is to work with the Barnard community to provide alcohol and drug prevention, education, and clinical support to the entire Barnard campus. Our main goal is to promote the health and well-being of our Barnard community. Through Furman, I provide non-punitive confidential services through either individual counseling sessions or groups where I meet with students to discuss their relationship with alcohol and other drugs, provide education, and explore the impact that substances has on their lives. ASAP is a service for all students. I also work with students who are affected by substance use in other ways, such as a family member or a partner with a history of addiction and how that impacts the student's life. Lastly, we collaborate on a plan on how the student can create a healthier relationship with alcohol and other drugs and seek long-term resources, whether on campus or off campus. The next part of ASAP is our outreach and prevention on campus. So I partner with the larger community that includes programs through health and wellness and the LeFrak Center, which April actually will talk about a little bit later, to create community events, workshops, trainings around substance use education. ASAP is a harm reduction program. Our mission is to provide a non-judgmental space that respects and honors students' decisions while increasing their awareness on their impact of their choices on their overall functioning and their successful college experience. Lastly, all incoming students should have received an invitation from the ASAP email yesterday to complete the Alcohol Wise, which is our educational summer programming. It provides a personalized look at your relationship with alcohol and includes education about substance use in college life. And lastly, provides resources on campus for a variety of needs. We review all of the data from Alcohol Wise, and it provides us with information to create prevention programming that services the needs of our incoming students. So completing it is highly encouraged and appreciated. We are currently located in the Furman Counseling Center. We utilize all of Furman's contact information for scheduling and more information alongside our asap@barnard.edu email. Thank you so much for attending today, and I'll pass it on to April.
Thanks, Kaswana. Good evening, everyone, and really wishing you all a very warm welcome to Barnard. We are excited to have you joining us very soon. I'm going to back up a slide. You may have seen it very briefly. Right there it is. So my name is April. I use she, her pronouns, and I am very honored to serve as the new executive director of the Francine LeFrak Foundation Center for Wellbeing. And this role actually marks my third inaugural role at the college at Barnard. I previously led the college's pandemic response team and then followed that with leading our public health response team. And, you know, I have a background in medicine as a PA and extensive experience and education in public health. And it really has led me to valuing the importance of wellness, particularly within a community setting and particularly within the community of Barnard. My commitment to wellness is really rooted in the belief that we are living, we are studying, we are working together as a community. And when we can do that in a supportive nature, it really benefits not only the individual, but also all of us that are in community together. And the Francine LeFrak Foundation Center for Wellbeing, which we lovingly call the LeFrak Center, is really meant to be a holistic approach to health and wellness on campus. The mission of the LeFrak Center for Wellbeing is here, and it's really a multi-dimensional approach with the goal to set the standard for wellness in higher education. It's open to the entire Barnard community, so different than the programs that you just heard about that are really focused on students, one-to-one interactions with students. This is really for the entirety of our community. So not only students, but also faculty and staff. Offering holistic support and programming across key dimensions of health and wellness, and particularly three, so physical, mental, and financial well-being. believing that when we are well in each of these areas, that it can help foster resilience and promote lifelong success. This is a new center on campus. It is opening soon, which is very exciting. It's under construction. I was last in there on Friday, and it's literally in the center of Barnard's campus. So when you enter the front gates, it's really meant to welcome you figuratively and literally. It's a place where everyone can go and just sit, where they can connect with others, really, again, meant to positively impact a sense of community, and will offer a full range of programming in each of these 3 areas. So the 3 pillars are listed here, and while they're distinct areas in and of themselves, we know that there is space and opportunity for these to intersect. And although the center is soon to be opening, there's been already programming that's come out of the center, both in the financial well-being, in mental well-being programming. And so I'm really excited by the opportunity for the center to open, to bring even more programming to the community. And, again, I think this idea of looking at how these areas intersect is really important, as well as how we're collaborating with other campus partners. So while PCHS and Furman are really those direct one-on-one service providers, the LeFrak Center is really meant to offer more of programming and resources and workshops, identifying needs, and then connecting people with the appropriate resources. These are some renderings. I wish I had real photos because, again, I was just in there last week, but you can see it's a very open space, very light, very bright. The colors were chosen very intentionally, and it's really unlike any other space that we have on campus. So it's really, there's a lot of literal space to just sit and be, have a conversation, study, and just connect with others. So we have a ton of program offerings. This is just a brief little glimpse. We will have a brand new fitness center, which we're very excited about. I think it's almost 4,000 square feet. And again, will be available to everyone on campus, so our entire community. We are also partnering with a group that does feminist self-defense. Financial Wellbeing Certificate Program. This is a really incredible offering. We offer this to any Barnard student, and actually we did our first year last year. So this year will be the second year, and we'll have a part 2, and we're building on what was learned. And it's really exciting because it's peer-led, so it's overseen by staff, but it's really driven by other students. So we have what we call LeFrak ambassadors, and a lot of them have different areas of focus, areas of interest, and we have a couple who are really dedicated to financial well-being. And last year they designed the curriculum after the Barbie movie and had very applicable, relatable graphics and messaging. This year, I'm really excited about it. They're basing a lot of the curriculum on Inside Out and really looking at feelings around money, because all of us have feelings around money and beliefs around money, and how our families looked at money and what does that mean to make a budget based on different parameters. There's a lot of other things. We have walk-in talks. We're developing first aid programming for new parents. We have tabling that's available for different awareness days, different awareness months, lunch and learns, book clubs, trauma-informed yoga. Radical empathy is another thing, initiative that I'm really excited about. And just, again, how do we equip certain members of our community, ideally the entirety of our community, to be empathetic towards others? So creating safety, a feeling of safety, and well-being across campus. And then lots of events and community building for new students as well. You know, hands-only CPR training, a lot of different things that I'm very, very excited about. Some more graphics. This is the fitness center here, also on the lower level. So it's essentially 3 floors of, again, that first building when you walk into campus. On the very lower level, we used to have a swimming pool that has been filled in and is now a very beautiful theater. And it's really multi-use space. So it has retractable seating, so it can be used as a classroom. It could be used to, you know, screen a film on reproductive justice. It could, you know, the seats could be moved back and it could be used as a space for dance because there's specialized flooring that got put in. So there's, again, just a lot of opportunity and really beautiful space. Part of the team that I used to manage, so the public health response team, has moved under the umbrella of the LeFrak Center. And this team, which is really now more of just a program under this umbrella, is really committed to promoting health and well-being of our campus community by implementing proactive and effective strategies to prevent, mitigate, and respond to public health challenges. So every person on this call, or every student certainly, has already interacted with this team because you already sent us your incoming student health forms and vaccine forms. So that's part of the work that we do. Also, it was a lot more previously, but monitoring COVID-19 response, giving guidance, and really making expert decisions. So when to mask, when we stopped masking, when to test, how to report tests. And we really do that monitoring the data and looking at clinical guidelines. We also meet quite frequently with a group of both infectious disease and public health experts at Columbia Medical Center. And that's more of what we do, but I'm going to pass it over to Zaisha.
Okay, good evening, everyone. And like all of my colleagues have said, thank you so much for joining us this evening. We're very excited to have you all here and very excited to welcome you all as part of our Barnard community. So as mentioned, my name is Zaisha Nadler. I use she, her pronouns, and I am the prevention program coordinator for prevention education here at Barnard. And I'm going to speak specifically to 2 of our programs today that is made up of not only our mental health and wellness pillars within the LeFrak Center, but also our pillars of health promotion and education. Oops, sorry. There we go. Our pillars of health promotion and education. So health promotion and education is created at Barnard and was created at Barnard to promote health and wellness of the Barnard student body within our peer education program, our programming, our education and outreach that we do. We also do individual health behavior consultations, which I'll speak a little bit more to a bit later, advocacy for a lot of our students. And there are 3 programs, one of them which you've heard of earlier, our ASAP program, the Alcohol Substance Awareness Program. But then we have 2 more. So the Wellness Spot, which I'll start with, and then the program that I oversee being Barnard. So the Wellness Spot is one of these spots that will be moving to the LeFrak Center for Wellbeing. We're very excited for this move. You'll see our space. It looks lovely. Purple is like the color created by students and really pushed by students. The Wellness Spot also comprises of both staff hours and peer education hours. I will speak a little bit more to the peer education program shortly. During the staff open office hours, you can drop by to speak with the program coordinator there and learn a little bit more about any questions you have regarding general concerns of fitting in on campus, anxiety, you want to know more about menstrual products or sexual health, looking for connections. This is a great place to have and be connected to peers on campus, but also other resources and be referred out. So you can always drop by the Wellness Spot. You can also follow the Wellness Spot on social media, especially on Instagram. You'll see a lot of postings from not only our staff member, but also from our peer education students themselves. And we also have a blog. So I definitely recommend checking out our postings and being open to following us on social media, especially Instagram, to stay up to date to the health and wellness things that are happening at Barnard and within the Wellness Spot. itself. Some of the things that you can do in the wellness spot or drop by for, again, you can learn and talk about different topics of health and wellness. Before getting to Barnard, I never even thought about talking to someone about sleep, but that's something you can definitely do at the wellness spot. You can also take a nap. We have very comfy couches, and we will have comfy couches in the new space. We have a huge wellness library, different topics from nutrition, body positivity, relationships, sexual health, again, really huge component. So you can pick up menstrual products for free. We have different kinds available. If you need a cup of tea, chocolate, this is just a space where we want students to come in, be brave, relax, and rest and recharge to be able to take charge of the next day. We do a lot of crafts, especially with our peer educators. So if you're someone who is always looking to learn how to knit, learn how to journal, you enjoy creating different designs, embroidery, you can always drop by. We also do a lot of water painting. You can drop by the wellness spot and interact with our peer educators as well. This is a peer education group from 2023, 2024, and they are specifically trained Barnard students who provide information. They conduct outreach and engage in advocacy and really develop a lot of our programming around campus. And so you'll see them often with their Be Well shirts on, or you'll just see them tabling in what we call our Diana Center, really engaging with a lot of our students. They also have late night office hours. So in addition to our staff office hours, you can also engage with your peers. That happens throughout the weeks. Times are still to be determined once the semester starts, but we'll make sure you'll definitely receive that information. And then we have dedicated people of color and LGBTQ+ office hours as well, to make sure that people within different communities have affinity spaces where they can, again, be brave and show up as their authentic self at any way. So you can connect with peer educators, go to any of their events and talk with them. Again, they're trained to handle different situations, and they're also there to help and guide a lot of our programming that we do day in and day out. As a first-year student, you will have to wait until the end of your first year in order to engage and become a peer educator, but we definitely welcome a lot of applications once you have completed your first year and have learned a lot, and we love to have students join our team as peer educators. And so that's the wellness spot. In addition to the wellness spot, I oversee our Being Barnard program. Our Being Barnard program, the mission is to provide a holistic approach to sexual violence prevention through campus-wide campaigns, educational programming, one-on-one health consultation services, community building, outreach, advocacy, and intervention. And so the office is currently located in primary care health services, but again, another exciting move to the LeFrak Center of Wellbeing within Barnard Hall coming soon. We are still working on the official open office hours, but again, you'll be able to drop in, speak to me, any conversations or concern that you might have about all types of relationships on campus, building those out. If you're wanting to learn about bystander intervention, you're seeing something, you don't know how to respond, or you want more tips about how to respond, you can always reach out. We also have an Instagram and a Facebook page that you can follow us on. It's at Being Barnard on all platforms. And you can feel free to email beingbarnard@barnard.edu to find out more things that we have going on throughout campus. More in detail, things that you can come to Being Barnard about. Again, you want to talk about different topics and programming, bystander intervention. Consent is a huge topic that we talk about often. These are not topics that we can talk about one time. We love for this to be ongoing educational sessions. So you can come speak with me one-on-one. You can come if you joined a group or a club on campus. You can bring them in and speak to them as well. If you're someone who is looking to be involved, but you're not sure what your time is going to be like, the advisory team would be a great space for you. Those are for volunteers. We meet once a month to, again, discuss different programmings and things that's happening on campus, larger conversations in the world that's happening or nationwide, to figure out how can we really change and address violence prevention on a large scale. And again, some confidential support is available to all entering as well. Lastly, another huge part of Barnard and the Being Barnard program is our clearing internship. We are so grateful and honored to be an endowment and funded by a Barnard alum Mrs. Constance Cleary, class of 1953, as well as her husband, Howard Cleary, in the memory of their daughter, Jean Cleary. So if you're familiar with the Cleary Act, the mother is an alum of Barnard College. And so their family has graciously gave us an endowment in order to really put forth more emphasis on our violence prevention education. And so we do have a paid opportunity for Barnard students to engage in their interests of violence prevention, to really bring more awareness to the different resources that we have available to students, not only including being Barnard, but also the Columbia Health Sexual Violence Response Team that also has a huge amount of services available and a 24/7 hotline. So if you can't reach myself throughout the day of a 9 to 5, you can definitely contact Columbia Health Sexual Violence Response at their 24/7 helpline as well. And the picture there is one of the panels from our 18th annual Cleary Lecture Series, where we brought a bunch of different people in to speak about the intersectionality of sexual violence and how do we really support survivors where they're at and people who've experienced violence where they're at, but also create a future where we are being proactive in prevention. And so I welcome anyone to come and ask me any questions in the chat or in the future. Again, you can email beingbarnard@barnard.edu for opportunities to engage in sexual violence prevention, domestic violence prevention, dating violence prevention, and engage different conversations. And I will now pass it back over to Caitlin.
Thank you all so much. That was fantastic. And we squeezed in a lot of information over the last 45 minutes. I'd like to invite all of our panelists now to go ahead and turn on their cameras. I will stop sharing the screen for a moment, and we can go through some of the questions. And please continue to put your questions in the Q&A as we go as well. So first, I'll start by saying, I know that all our incoming students are starting to look forward to arriving on campus and to orientation. Can you talk about what students will experience and how they'll learn about your areas during orientation and during their first semester at Barnard, but also, you know, throughout their time at the college, how will they learn about all of the events and programming that you all are putting on, as well as simple things like looking up what time the health center is open and things like that. Who wants to start? Betty?
I guess I'm first on the boxes. Yeah, so we do have during orientation, we'll have tabling events so that students know who we are. They can meet the staff face to face. Last year, we made little business cards with our information. We can put our QR code on it moving forward this year so that students could put it in their ID holder so that they all would have the information handy. And then it gives them an opportunity to ask questions one-on-one. And then during the year, we also have various programming around health promotion. We've had flu clinics where we'll, have prizes and different ways to encourage students to ask questions around vaccines and give them opportunity to receive vaccines, boosters and things like that. Those are things that we do throughout the year.
I can share for Furman, we also are involved with some of the new student orientation activities. So I think all incoming students hear about us pretty early on, but it's really an ongoing effort of outreach because the students get so much new information on day one, but all of our information is also online. We're very accessible, really 24 hours a day. And a lot of community partners are also very aware of the healthcare services. So their RA in their dorm is going to know how to bring them to PCHS or to Furman counseling, and so will faculty and so will others. So I think part of our outreach is directly to the students, but also to the community at large who supports the students equally.
And I'll speak for Being Barnard. So I have a mandated session that you all will be attending on the Friday, and mandated in a good way, not in a, I have to be there. So it will be a fun session. You'll be learning a very quick snapshot of what bystander intervention looks like. So knowing how to engage, talks a little bit about the safety aspects of New York City. What are some things to look out for and be aware of, and how you can respond to certain things and help people, help yourself and stay safe navigating the city. We'll also talk a bit about relationships, building and maintaining healthy relationships as well.
And I think for my area, just to echo a couple of things is, one of the big initiatives is to really collaborate with other departments, with other community members. So if one person doesn't know the answer where to connect the student, we will get the student where they need to go. And the LeFrak Center is literally the center of campus. So you can always go in there and someone will know how to connect you. And if I can just quickly answer two of the questions that I saw in there about LeFrak, we don't have an opening day yet. We are still waiting for the official paperwork. Construction is done. So we're just, waiting for the official paperwork. But goal, hope, dream is end of this month, beginning of next for an opening. And there is no more pool at Barnard College. So yes, there is one across the street at Columbia.
And just similar to everything that everyone said, the uniqueness about ASAP is that it's a program that provides clinical support through Furman, but it also provides outreach and prevention services through programming with the larger community and a variety of health and wellness programming. So either through outreach or through new student orientation, students will definitely be able to access ASAP and all of our services throughout the academic year.
Thank you all. April, just building off of the pool question, and we've talked about this exciting new fitness center coming to Barnard. Can you just give a little bit of an overview beyond that, or including that, about physical fitness opportunities and what our students usually do for physical fitness? I know there's some classes and also just roaming around New York City as well.
Yeah, great question. So we certainly haven't had a large fitness center, and students can pay to go across the street, which, it's interesting because this time last year when I was doing this similar panel, a lot of concerns that I heard from parents were, my student is going across the street, it's quite late at night. So there really has been a demand, both from students, I think also from parents and families. We'd like something on Barnard's campus. So it's really incredible to be able to offer a space that is entirely ours. It will have a range of different types of equipment. I am not responsible for the selecting of those because that's not my area of expertise, but we had a PE faculty person, and the PE department has been really supportive. We'll continue to have, we call them Fit Bear, but they're community fitness classes. So things like yoga, things like Zumba, bar. I don't remember all of the offerings. But I think, and just being in New York City, if you're not from here, the opportunities to walk and to move your body abound. Also be opportunities to dance and be creative. Part of the physical well-being offerings from LeFrak will be walk and talk. So we are quite near a couple of parks. So walking to the park, walking by the river, talking about a particular well-being topic or health topic, lots of opportunity. And the fitness center really is beautiful. So.
Thanks, April. Betty, we had a question about whether primary care health service includes allergy shots.
Yes,
and what the process would be.
Yes,
Perfect.
So I will address that, and I'm also going to take the opportunity to address the insurance because I feel like we have a lot of questions about that. So we currently are not offering allergy shots, but we can work with the family even ahead of time in terms of coordinating a referral to a local allergist. We work with a local allergist already with students who need allergy shots. So we don't currently offer that, but more to come in terms of developing a plan to do so. But we can work with the family to find someone to do that. I just wanted to address, hopefully that answered it for that person. I just wanted to address the insurance piece. So students are automatically enrolled in Aetna Student Health. That's the Barnard insurance and people have been referring to. If for some reason parents or families don't want to be on Aetna Student Health, you can do a waiver, and we can share the link for that, to use your own insurance. So it's not that you have to be on our insurance, but if you don't change it, you're just automatically on it, just so you know. But you do have the ability to waive it. There is a link on our website, and we can share it here as well. And when I stated earlier that we do not take insurance, so regardless, I know someone was saying, I have this insurance, do you take this? We do not bill for our services. When students come to see us at PCHS, we don't do any billing of insurance. The only instances where insurance comes up is if I see a student and a prescription is sent to a pharmacy, the pharmacist will ask the student for their insurance card and they will bill the insurance. The other instance is when we do labs. So if we do a physical exam and, you know, blood work is done or a throat culture is sent to the lab, we will send that specimen along with insurance information, and the insurance will be used in that way. But we personally do not bill insurance. I think someone asked them, why do we have to have the insurance? It is important that all students are insured, whether it's through Aetna Student Health or a comparable coverage that would provide services in New York. Someone, I think, mentioned about emergency services. If your child has to go to the emergency room, and you have your own insurance, you just want to ensure that those services would be covered in New York State, because it can become costly to get an X-ray in an emergency room and to be seen by this person. So, the different specialists in event of an emergency. So it is important that all students are insured, whether it's Aetna Student Health or you want to do the waiver to do your own Blue Cross Blue Shield. There's some questions you would answer in terms of coverage, and make the determination that that insurance is adequate. International students absolutely have to have coverage that would have coverage in New York State as well, because I think I saw a question about international students. So hopefully I answered everyone's questions around insurance. So, and I don't know if Dr. Shaw wanted to say anything about the medications.
I might just add to that a little bit. Furman Counseling Center is very similar to PCHS in that we don't bill for any of the services that we provide on site, but students can have ancillary costs, just like medications, labs, as mentioned. And I also wanted to share, in terms of mental health care, we are a short-term model. So a student might come to us for just a few sessions of therapy. For psychiatry, they might come to me for an initial evaluation and a follow-up appointment. But we really refer, I can say for all of the patients I see in psychiatry, the vast majority I have to refer for outpatient psychiatric care that's more ongoing, especially for our students that are going to be in New York for 4 years. And so for my students that have had a very state-specific insurance like Blue Cross Blue Shield of X state, it's been very hard to find them care in New York. Even for some of my students that have Blue Cross Blue Shield of New York, it's been hard to find New York City psychiatrists that accept that insurance. I know there was a question about Kaiser. There was a question from there's been several different very specific insurance questions, but without going into each specific one, almost all of our state-specific insurances have been more challenging to find providers. We really have the most robust network of referrals for Aetna Student Health. In fact, we have a lot of partners in the community, including therapists with very vast expertise that partner with us because they like working with Barnard students. So that's just one plug for mental health, because it's almost always long-term.
Thank you both. I have another question, since we have both students and their family members in this conversation. Can you talk a little bit about what information, if any, parents have access to in the health sphere and how confidentiality works in your areas?
I'm happy to go first. I imagine it's similar, but at least for Furman, our services are confidential. And so for our students that are, emerging young adults, we really support their autonomy. And so it's confidential from their parents, it's confidential from their faculty, it's confidential from their RA. We really try to maintain confidentiality. And then in times where we think it would be helpful to disclose to family, we also can do family meetings, but we really like the student really to support them in taking the lead when we are disclosing or when we are planning with others. So we do collaborate with families, we collaborate with other providers at home. We do that regularly. We usually let the student take the lead. One of the few times we'll break confidentiality is when it's an issue of safety or acute risk. And in those cases, we do break confidentiality regardless of the student's wishes.
Yes, it's very similar in terms of confidentiality from other students, faculty, parents. In the event of emergency or cause of concern around safety, certainly those some of the exceptions. And regardless of age, if it's around reproductive health, there's laws that protect around confidentiality with that as well.
Thank you both. I have one more question for you all. You all work closely with students across your areas. And our students, of course, are excited and looking forward to starting at college, but of course, there also is a lot of adjustment to be had, and it may be stressful and challenging at times. Can you talk a little bit about some of the bumps in the road that students might anticipate? If you have any advice for them on best meeting those challenges, and if you have any advice for our parents and family members here on how they can best support their students.
I might just share some of the bumps and challenges. I think transitions are hard, right? I think this transition to college is so unique during such a formative time for our students. And so it's going to bring up new challenges no matter how prepared you are. And so one piece of advice that I give to my students, my colleagues, my trainees is always just never worry alone. There really are a lot of people here ready to support our students and ready to work with families, and we do this every day. So that would be my one piece of advice.
I would say something I find myself always saying to students: there's no silly questions, there's no stupid questions. Believe me, if you have a question or concern, just ask us. I think April had mentioned, if one of us doesn't have the answer, I mean, Dr. Shaw knows, like, we've walked over to each other's space with a student. If I don't have the answer, she may have the answer, April may have the answer. So we do work really well and collaboratively together. But if you do have a question or concern, trust me, you're not the first person to have that question or concern. We've probably heard it before. And we're here to help you with that. So please ask. That's why we're here.
I would say to be very kind with yourself, both as parents and as students. I think, obviously the academic achievements are enormous. You're coming to Barnard. But I think just giving yourself time to sleep, to read a book that is not related to school, to have fun, to enjoy, and just be really, really kind with yourself. Because the academics, you've got this.
I agree. I'll just add, remember your why. It's something that I speak to my students a lot, and the peer educators and the interns a lot about reminding yourself, one, you've got here, right? And that's a huge achievement in itself. And then reminding yourself why you're here, what you're looking forward to, and taking it one step at a time, one day at a time. As everyone said, you're really not alone. If you reach out to one person and that person didn't have an answer, try to connect with someone else still at the same time. Even to parents, to check in on your child, or whoever you're sending to school, really check in. It can be hard sometimes, and there might be times where they don't answer, but it's still okay to check in on them, make sure everything's going well. If you can send a care package, I know those go a long way for a lot of our students as well when they may not be hearing from someone, and just a reminder that you're proud of them and how much they've accomplished, as well as really nice reminders.
And I'll jump in, and I champion everything that's everyone has said today. But I also would say that there's a lot of things that are going to be happening, and it's a vast new world that you're entering in. And one of the number one things that we tell our students is that good sleep and eating and taking care of those foundational needs are so, so important. Many of the work that we do to help folks that are struggling is to remember how to take care of themselves and how to get back to those basics that we kind of forget when everything is rushing by and we're trying to make those deadlines and do all of the things that we said that we're out to do. Taking good care of ourselves is the main way to get to the wellness that you're looking for.
Thank you so much, everyone. That's a great way to wrap up our Q&A. I'm going to share my slides one more time. Thank you to all of our attendees for being here as well. I hope this was helpful for you. If you have any more questions, please don't hesitate to reach out to our campus partners or to me. I can be reached at parents@barnard.edu, and I'm always happy to answer any questions you may have or to connect you with the person who has the information that you're looking for. Please do join us for our upcoming sessions. You can find them listed here. The next one is this Thursday, again at 7 p.m. EDT. If you're not able to join, remember that the sessions are being recorded. So that will be there as a resource for you as well. Thank you again for joining us, and have a great rest of your evening.